A very pleasant afternoon to one and all present here. Today, this is me, Fariha Khan, special educator from Pinnacle Blooms Network, and today with me is accompanying
Maimuna Fatima, occupational therapist from Pinnacle Blooms Network.
Okay, so today's our topic of webinar is case history taking and teaching strategies in special education. Before moving on to the main topic, let us just let me bring you to the topic today. Okay, so what usually happens is that how do we get to know that our child is special or our child is lagging behind or something is unusual with the child? So what happens usually is that if a child is born after 6 to 8 months, what happens is that we keep observing the child, and when we get to know that something is missing in the child or something is lagging in the child or some developmental delay is there in the child, how do we do that? We start comparing our child with that of others or the younger child with that of the older child. Okay, so we get to know, okay, my first son used to walk at 1.5 years of age, and this child isn't walking till now. He's 2 now and he's unable to walk. So what we do is that we compare the one which is present, the youngest child, with that of the oldest child, or either we try to compare our child with that of other child. Okay, this so and so person's kid is able to say this alphabets or 2 to 3 letter words, but my child is unable to do these things. He might be lagging in walking, he might be lagging in speaking, he might be lagging in visual seeking, or many other things as well. Okay, so what happens once we get to know, once we are confirmed, or once we are still in a doubt that something is lagging in our child, what do we do? First, what do we do is that we start taking suggestions from other people as well. Okay, my child is doing this. Is this an issue, or am I thinking too much? We ask our close ones. Okay, being a mother, we may ask the father of the child, or we may ask our own sisters or the close relatives. Okay, we just try to get that confirmation that are we thinking too much, or is this problem specifically there? Okay, once we get to know that there is a specific thing, so the child is actually lagging behind, he is not behaving normally, what do? We try to get the confirmation. Confirmation from whom? We go for proper assessment, or we try to go to the correct person who will guide us after that. Okay, so when we go to that person, usually doctors or people who assess these children, or to an early interventionist who will guide us through, what do? What is the first step they do when we approach them? They do nothing but they try to gather the information till the child is present. Since the child was born, before the child was born, and after the child was born, and till present, how is his behavior, how is his development, and what is lagging behind. Now, why is there a need to gather all this information? Why is it so important for the early interventionist to gather all these information, to keep asking questions related to the child, related to the mother, related to her, pregnancy period? Why is it that important? It is important because it gives us facts and knowledge about the child by which we can get to a conclusion. Okay. So, when we as a parent go, we don't know why the person is asking. And being a therapist, if you are watching as a therapist, you should know what to ask and what not. And if a parent is watching, the parent should know why is the therapist asking. And that is the reason today we have chose the topic case history taking and teaching strategies in special education. Okay, now let's just throw some more light to this topic, case history taking. So, case history, the word itself says is that we are getting to know the history of the present case. Okay, so let us now discuss what all is asked in case history, what all information do we gather in case history taking, and how will it benefit us to come to a conclusion. Okay, so first and foremost thing, what do we do in case history taking is that we collect the demographic information. So what is demographic information? Demographic information is nothing but the personal details of the child. What is the name of the child? What is the age of the child? What is his father's name? what is his mother's name, and where do they reside, where is their location, and since how long have they been, when did they notice the changes in the child, okay, and what are the presenting complaints, are the presenting complaints of the parents from the child, okay. This is the basic demographic information we choose and we try to gather it. Why do we gather this information? We gather this information because we have to use it for further record purpose, okay. This will help us, let us know the basic information of the child, from where is the child coming from, what is his parents name, what is the child names, to maintain, to keep a record of all these things, okay. Next, once we are done with this and once we get to know the presenting complaints, we throw a light on what are the presenting complaints. Are those complaints actually complaint, or are those just facts that are bothering the parents, okay. Is it actually a complaint or not? We come to a conclusion. Is it a complaint or not? Okay. Once noting down the presenting complaints, we take the history of prenatal period, neonatal period, and postnatal period. Okay. So in prenatal period, we ask questions that are related to the 9-month duration of the pregnancy. What all has happened in that pregnancy? Okay. When did the mother conceive? What was the time when the mother conceived? Okay. And what was her age when she actually conceived? And was she okay in the 3 trimesters during that pregnancy period? Or was she exposed to some alcohols or some drugs? Was she into a stress? Or was her BP high? Or did she met with an accident? Or was there any environmental exposure to the mother, and did she took proper nutritious food, and did she took the doctor prescribed medicines or not, and was she able to feel the movements, and was everything going all right during that prenatal period, okay. And everything, was the fetus or womb responding accordingly, and was the fluid capable enough, and was the scanning reports as per what the doctor was expecting, or was there any glitch in that, okay. Once we get to know everything about this prenatal period, we are actually taking this information about the prenatal period to get to know, might be there is any cause that might have led to the special child, okay. See, any disability does not have one root cause or one perfect cause that by which we can say that this disability has occurred due to this cause only. We just keep it on, may factors, like maybe because of this, maybe because of that. But we cannot surely say that disability has occurred because of this specific cause only. So we are just trying to gather the information to collect the may factors, what all might has happened, what all might have gone wrong, or was everything into the place in this 9-month duration, okay. Once we collect this information, we go to the next phase, that is perinatal period. Perinatal period is nothing but the period that starts once the child is born. So we ask questions like, was there an immediate cry? The cry was present. Did the child cry immediately after the birth? And was there any respiratory issue? Was he not able to breathe? What was the color of the child? Was it blue? Was it yellow? Or was it pink? Pink is the natural color by which the child is born. Blue represents that the child had respiratory issues and he wasn't able to breathe. Yellow also represents that the child might have jaundice. Okay? These are the things by which we come to a conclusion. After that, what we ask is that, was there a cord around neck when the child was born, and did the child had fits or seizures? Was the child having seizures when he was born? Was the child kept in incubator say after he was born? And how was his condition up to 2 to 3 days? Was he able to suck? Was he able to respond accordingly as the normal child does? And what was this? Was the child given the proper nutritious food? Was he able to be fed properly? These are the questions what we asked. To get to know that, to get to know again the may factors, might be there was a respiratory issue, Might be there was because of the having cord around the neck. Might be there was a delay in the child. Might be if the child's birth cry is delayed, then they might have this might lead to delay in development as well, or anything that might be the factors that might lead to this disability. Okay. After this, what we get to know is that postnatal period. What is postnatal period? Once the child is born and once he is healthy enough, postnatal period starts since the child is born up to the present age. Okay. So after that, did the child met with any accident or any head injury or any severe disease after that, after which the child's growth has stopped? For example, was he suffering from pneumonia or jaundice, or any was he having seizures, or was there anything or an accident or something that has led to the developmental delay in the child, that has brought some changes in the child? Okay, this is what we asked. Then what we asked about the parents is that the family history. Family history is nothing but the history of the parents. We draw a family tree wherein we include the grandfather, grandmother, and how much sons do they have, sons and daughters do they have, and how much children does each son and daughter have. Okay, and then we get to know that is there any genetic factor in this family? Is there any child who is actually having the same issue? Is there any child or any mother who had a miscarriage, or whose child is disabled? We just get to know, that is it genetic, is it in the family itself? Okay, so we get to know the family history of the child, taking the information of the immediate family members, only the immediate family members of the child. Suppose if there is a mother, if the child is born, is there, okay, and the mother of the child had a miscarriage, okay, or after the birth of the child, after 3 years, there was because of some disease, the child was dead. Okay, so we put some certain we make use of certain symbols. We draw a circle and put across a slant line just to show that the child is no more. Or if the child is disabled, we put a circle and put a dot in it. If the child is normal, we simply draw a box. So these are some symbols which we use just to get to know the simple family history of the child. Okay, for further reference and to get to know is this genetically present. Okay, once taking the family history of the child, we go to the second step, is that developmental chart. When was the child able to respond? Like up to 0 to 4 months, was he able to observe his surrounding? Did he move his eyes from right to left when anyone was passing through? Did he responded to light? Did he responded to the sound? We will ask these questions. Up to 4 to 6 months, was he able to turn himself upside down and try to crawl? Was he able to hold, use his fine motor skills to pick up objects or play with them? Was he able to make a high hand coordination to play with objects? Did he hold your finger when he was sleeping? These are all developmental milestones. Like at this age, the child should be able to do certain sort of things. Might be a month before or after, but the child should do this thing, because this stage the child should achieve this milestone. That is what is important. So we check the developmental milestones of the child. So just to get to know, from when did the developmental milestone started delaying? Usually parents come and say that the child was totally normal up to 1.5 years of age, and after a period of time we started seeing the regress. Okay, so we have to cover that phase of time where he started getting regressed. Okay, what was the main thing? What has happened in that period of time that the child has started regress? And up to what extent that is the regress? Did he came from 90% to actually 0, or did he reduce 50% or up to 60%? What was the percentage of that regression? Okay, this is what we collect in the developmental milestones chart. Once we complete this, what we do is that we start collecting the information that is related to ADL skills. ADL skills are nothing but activities of daily living. Like for example, if a child is 2 years old, was he able to hold the brush? Did he brush? Did he cooperated while bathing? Did he use to feed himself when the food was present in front of him? Does he eat semi-solid food when it is mixed and given? Does he eats with his fingers? And does he knows the concept of combing his hair? And does he knows of the concept of applying powder on his face or applying bindi when if it's a girl? Does he knows how to dress himself, undress himself, button, unbutton, zip, unzip, and use the daily activities like making himself independent in the daily course? Does he cooperates or helps in functional activities like setting the dining table, bringing the plates from the kitchen and keeping it on the dining table, or dusting the furniture? These are daily chores what a usual or normal child does. Does he cooperates in all these activities? Okay, because this is the first educational concept directly or indirectly the child is learning. Okay, once he is done with the ADL, once we are done with the ADL part, we go to the academic part. Okay, where we ask simple questions like is he able to identify alphabets, and is he able to pay interest in educational concepts like number identification, alphabet identification, things around him? For example, does he identifies light, fan, and table, chair, sofa, fridge, washing machine, etc.? And is he able to identify what he is eating, eatable and non-eatable items? Is he able to identify what is he is eating is a fruit, and is he able to differentiate between different fruits and vegetables? And does he identify where he is traveling, what is the thing that in which he is traveling, it is a specific transport or not? So these are the things which a child is exposed to since his birth time. Okay, we go to doctor for vaccination, we travel, we feed him food, that is a fruit again, we feed him vegetables, that is a vegetable again. So these things are already introduced to the child up to 2 to 3 years of age. So we ask the question that when these things were exposed to him, introduced to him, now is he aware of that concepts or not? Okay, then we go to the education part like number identification, alphabet identification, and rest other things. Okay, to get to know up to what particular level is the child standing presently, and in how much areas is he independent, and how much areas is he lagging behind. So this is what we ask. Once we get to know all these things, we again go to the concept of self-identification. Does he identify his own self? Is he able to identify when we call his name? Does he respond to his name? And does he identify his family member? Okay, this is my mother and she has a specific role in my life. He is my father, he has a specific role in my life. These are my siblings. These are my peers or my friends. Does he plays with 2 or more children? Does he cooperates while playing, or he isolates himself from others? What is the thing? They are searching certain characteristics of disability. So we just cross check whether anything is present when you are giving the information. Once we get to the information, once we gather this information, we come to a conclusion. Okay, what are the causes that might have lead to the disability, or that may not be a disability, it is just a developmental delay and can be improved to an extent, or it is at risk of disability. The child might fall into the category of disability, and hence the earliest therapy or earliest precaution is needed. Okay, we get to know and we tag that this is there, we have to work upon this, and if not, the child will fall into this risk factors. Okay, this is done in case history taking. So case history taking is very essential and the first step in coming to a conclusion. Okay, and proper case history taking and collecting, gathering the proper information is crucial as well, because this is something that we are tagging a child as disabled for a long period of time. Lifelong tag has been given to the child. So when we are doing something that is so sensitive, we have to be very particular about collecting the information and very accurate as well. Okay, next, teaching strategies. Okay, so there are few teaching strategies which can help a child to learn the concepts very easily and very quickly, and these teaching strategies can be used by any teacher or a homemaker or a housewife who is trying to teach the child. Now in the era of pandemic where online session is still going on, parents do not actually get the concept as to how to teach the concepts to the children, because they are unaware that what concepts teachers do use. Okay, same goes to the teachers as well. They get confused because online session is something that is really new to the teachers. So there are few teaching strategies which we can simply use in our day-to-day life to teach a concept, and the child hence can learn easily. Okay, first teaching strategy which we can discuss is chaining. Chaining is nothing but it is an instructional strategy in which every step is recognized as the requirement of task mastery. So simply chaining, the word itself says is that we are chaining something, we are chaining things together. Okay, for this, in this step what we do is that we write the steps of the task. Okay, we are teaching brushing to the child. What all do we know? The child need to first identify the brush. The child need to hold the brush in his hand. The child need to pick up the toothpaste in another hand. Then he needs to open the lid of the toothpaste. Then he needs to put the toothpaste on the brush. Then he needs to close the toothpaste and keep it aside. Then he needs to take the brush and start brushing. He needs to spit it out. He needs to open the tap for that. He needs to follow all these steps. So what we do is that we write minute every single step on a paper, and then we try to teach each step at a time. Okay, so what do we do is that we chain the steps together, hence allowing the child to learn one step at a time. Okay, in chaining, what thing is that we don't particularly focus on that step as well. We can teach first step, then last step, then sixth step. For example, the child now knows how to brush, then he doesn't know whether to spit first or whether to open the tap first. According to the needs of the child or according to what he can grasp easily, we can teach that step accordingly. Okay, that is there. Now chaining has two concepts. One is forward chaining and one is backward chaining. In forward chaining, we go from the first step to the last step, and in backward chaining, we first teach the backward step and then we go to the first step. Okay, this is there. The next teaching strategy is shaping. Shaping, again, with the word itself we can identify what does shaping will convey a message. Okay, it is reinforcing the successive approximations of the desired behavior. What behavior is desired out of a child? When we get that behavior, we simply reinforce that behavior. To give the confirmation to the child is that we are expecting this behavior out of you, and when you give this behavior to us, we will reinforce you. Okay, so when like for a specific task, for example, if you present banana in front of him, he doesn't know what to do with that. Does he should he try to eat it, or should he just observe that banana, or should he go and keep it aside, or what should he do? So once he does something what is expecting, if we are expecting him to eat, and once he does 10 things out of that banana, and out of 10 once correctly he just tries to eat the banana, we will reinforce him then and there, making him understand is that what you did is correct, and we are expecting the same behavior out of you the next time as well. So we are shaping the behavior of the child. The next thing, we can use the shaping technique in other things as well, like for example, if the child simply keeps crying and cooing, okay, and once he stops, we reinforce the behavior. We give him something that makes him stop crying, okay, and once we give him, he will start playing with it. Once he starts crying again, we remove the reinforcement from him. We take the thing, because to make him understand is that once you stop crying, we will reinforce you, and when you start crying again, we will remove the reinforcement from you. Okay, so we are directly or indirectly shaping the behavior of the child. The next thing is that modeling technique. Now, what is modeling technique? Modeling technique is the teacher demonstrating a task and then child learning that task independently. For example, let us take an example of clay modeling. Okay, we are sitting right in front of the child, and child is at a distance from us. Okay, then we ask the child to roll the clay. What the child over here is doing is that he is following our commands. He is copying us. He is learning the concept of imitation. He is learning the concept of learning by doing, and then he is also learning the concept of moving from the stage of dependence to the independence. In this, the child is performing everything independently without our prompt and without our support. That is there in the child. Okay. So this concept goes a long way in teaching ADL skills, whether it be aerial skills, whether it be recreational skills, or whether it be anything. Okay. So this is a very important instructional strategy to make the child independent in his areas of learning. Okay. The next thing, the next teaching strategy is prompting. Now, what is prompting? Prompting is a temporary assistance which we provide to the child in order for him to make the task easy and perform or complete the task. Okay, we are not completely supporting him in that task, but whenever and wherever needed, we are supporting him. We are helping it out so that he reaches the last stage and completes the task accordingly. For example, there are different types of prompt. For example, gestural prompt, verbal prompt, physical prompt, and for example, like physical prompt is that if a child is able to is writing and he doesn't know, if he is writing A, he is putting this upward V, but he doesn't know how to put the sleeping line. We simply take the hand of the child and put at the place where he can start drawing the sleeping line. But we will not give him the complete prompt of putting the sleeping line by our own self. Okay, we are just giving him a slight prompt. Now when he does this, we remove the prompt then and there. So this is the physical prompt. Or any task, if he is unable to pick up the things, we take the hand to that thing, but we will not take the thing by our own hand. We'll ask the child to pick up the thing. Okay, so this is the temporary assistance which we provide to the child, and whenever needed we just fade the prompts away. Okay, or for example, giving gestures. For example, if we say hi and he doesn't know how to say hi, we just give a gesture like this. So he knows, okay, I have to raise my hand and wave my hand to say hi. Okay, and if we say namaste, we are saying namaste, but he is unable to understand what I need to do over here. So what we do is that we show a gesture of this, and he will understand, okay, I have to join my hands together to say namaste. This is there. Okay, and verbal prompt is that verbally giving support. For example, if you are teaching him alphabet, what comes after A? Okay, he doesn't know that after A comes B. So we will say, or else he doesn't know what comes after B. Okay, so we will say A, B, then we put a question on it. So he will understand, okay, A, B, and then comes in a sequential order is C. We give partial prompts to this, and then we fade away those prompts accordingly. Okay, the next thing is fading prompts. Fading prompts is as important as giving the prompts. Okay, because the child will be totally dependent on us to do any task. So fading away the prompts is very important as soon as possible. Once the child is able to do the task independently, we have to fade the prompt away. For example, we are giving over here complete physical support. This is again support, and then we are moving our hand, making him to fade the prompts and also do the task independently. So in teaching strategies, we have discussed about chaining, shaping, modeling, prompting, and fading. These are very few teaching strategies which we can use at home to teach a child baking. And what are the simple teaching strategies which we can use at home as a teacher, as a parent as well, to teach the concepts to the child. Hope this webinar has become very useful to you and was very informative to you as well. And hope I was able to convey my message through this webinar to you. Hope I was able to communicate to you through this webinar, and hope to see you all soon again in next webinar as well. Thank you so much.
Thank you.